Assessing the skulls and face, eye structures and visual acuity, ears and hearing nose and cynosis, mouth and oropharynx and neck. The basic concept. Assessing the skull and face is an inspection and palpation of the skull and face and also measuring the skull circumference in which the presence of deviation and changes of facial shape may indicate disorder or certain condition. Assessing the eye structure and visual acuity is an examination of the eye that include the external eye structure, visual perception, ocular movements, and visual fields. Assessment of vision provides important information about the client's ability to interact with the environment and perform activities in daily living. Assessing the ears and hearing is an examination of the ear structures and determination of the client's hearing acuity, which consists of direct inspection, palpation of the ear, and techniques to assess the auditory acuity and sound conduction. Assessing the nose and cynosis is an inspection and palpation of the external nose structure and cynosis and inspection of patency of the nasal cavities. Assessing the mouth and oropharynx is an inspection of the structure associated with eating and taste, which is the composed of the lips, oral mucosa, tongue, floor of the mouth, teeth, gums, hard and soft plate, ovula, salivary glands, tonsillar, pilars, and tonsils. Assessing the neck is an examination of the neck muscles, lymph nodes, trachea, thyroid, blood carotid, and arteries and jugular veins. Objective: to check for any deviations of the skull and face, eye structures and visual acuity, ears and hearing, nose and cynosis, mouth and oropharynx and neck, the acquire information and accurate nursing history of the eyes and visions, ears and hearing, nasal, oral, and neck of the client. To be able to formulate the nursing diagnosis, collaborative problem, and referral. Preparation. Introduce yourself and verify the client's identity. Explain the client what you are going to do, why it is necessary, and how the client can cooperate. Perform the hygiene and observe appropriate infection and control procedure and provide for client privacy. Hello ma'am, good day. I am Carlton Menbuag, your student nurse. And today, I need you to cooperate.
Okay.
To start, inquire if the client has any history of the following: lumps or bumps, itching, scaling, or dandruff, ma'am. Loss of consciousness, dizziness, seizureness, headache, and facial pain or injury. If so, ascertain the following: how many lumps occurred, length of the time, any other problem existed, any known cause of any problem, and inspect the skull for size, shape, and symmetry. Palpate the skull for nodules or masses and depression. Use a gentle rotating motion with the finger tips. Begin with the front of the palpate down with the midline and palpate each side of the head. Inspect the facial feature. Inspect the eyes for edema and hollowness. If note symmetry of the facial movements and ask the client to elevate the eyebrows, frown or lower the eyebrows close to the eyes, and tight puff with the cheeks and smile and show teeth. I-kuan imong kuan ma'am, mata ma'am. Ituyok-tuyok. I-roll imong eyes ma'am. Smile, ma'am. Go. Document the findings in the client's record. Using the eye structures and visual acuity preparation. Assemble the all equipment and supplies, cotton tip, applicator, examination gloves, millimeter ruler, pin light, snellen, an e-chart, and opaque card. Inquire if the client has any history of the following. Ma'am, do you have a family history of diabetes? Hypertension or blood dicrasia? Eye disease, injury, or surgery? Last visit to an ophthalmologist. Current use of the eye medication. Use of contact lenses or eyeglasses. Hygiene practice for corrective lenses. Currently symptoms of any problems. Inspect the eyebrows for hair distribution and alignment and for skin quality of the movement. Inspect the eyelashes for evenness of distribution and direction of curl. Inspect the eyelids for surfaces, characteristic, position, and relation to a cornea ability to blink and frequency to blink inspection. Inspect the lower eyelids while the client's eyes are closed. Close your eyes, ma'am. Inspect the bulbar conjunctive for color, texture, and the presence of the lesions. Inspect the palpebral conjunctive by everything the lids. Invert the upper lids if any problem is suspected. Ask the clients to look down while keeping the eyelids slightly open. Ma'am, pag tanaw sa ubos, ma'am. Gently grasp the client's eyeglass with the thumb and forefinger. Sa ubos lang yung mata, ma'am. Pull the lashes gently downward while holding the eyelashes. Hold the margin of the everted lid or eyelashes against the ridge of the upper bony orbit with the applicator. Stick to your thumb. Inspect the conjunctiva for color, texture, lesions, and foreign bodies. Inspect the palpate the lacrimal gland using the tip of your index finger. Palpate the lacrimal gland. Observe for edema between the lower lid and the nose. Inspect and palpate the lacrimal sac and musolacrimal duct. Observe for evidence of increased tearing. Using the tip of your index finger, palpate inside the lower orbital rim near to the inner canthus. Inspect the cornea for clarity and texture. Ask the client to look straight ahead. Hold the pen light at an oblique angle to the eye and move to the light slowly across the corneal surface. Pag tanaw sa ubos, ma'am. Perform the corneal sensitivity reflex test or determine the function of the fifth cranial nerve. Ask the client to keep both eyes open and look straight ahead. Approach from the behind the side beside the client and lightly touch The cornea with the corner of Gauss. Kuan ma'am, steady lang yung mata ma'am. Inspect the anterior chamber for transparency deep. Use the some obligate lighting used when testing the cornea. Ano ni ma'am? Inspect the pupils for color, shape, and symmetry of size. Assess each pupil's direct and consensual reaction to the light in a partially dark room. Ask the client to look straight ahead using the pin light and approaching from the side. Shine at light on the pupil. Observe the response. Shine of the light of the pupil again and observe the response of the other pupil. Straightforward lang pagtanaw, ma'am. Assist each pupil reaction to accommodation. Hold the object about 10 cm from the client's nose. Ask the client to look first at the top of the object and then a distant object behind the pin light. Tanaw sa taas mo. Alternate the gaze between the near and far object. Observe the pupil response. Next, move the pin light or pencil towards the client nose. The pupils should cover. To record normal assessment of the pupils and use the abbreviation PERLA. Assessing the visual fields. Assess the peripheral visual fields and have the client directly facing you at the distance of 60 cm to 90 cm. As the client to cover the right eye with the card and look directly at your nose. Ma'am, cover your right eyes, ma'am. Ask the client to tell you when the moving object the first spotted. Man mo nakita ang kuan, ma'am. Ballpen. To reach the temporal field of the left eye, extend and move your right arm into from the client's right periphery. To test the upward field of the left eye, extend and move up the right arm. To test downward field of the left eye, extended and move the right arm up from the lower periphery. To test the nasal field or the left eye, extend or move your left arm in form of periphery. Repeat the above step of over right eye. Extraocular muscle test. Assist 6 ocular movement to determine eye alignment and coordination. Stand directly in front of the client and hold the pin light at comfortable distance such as 30 cm in front of the client's eyes. Ask the client to hold the head in a fixed position facing you and follow the movement of the pin light with the eyes only. Move the pin light in a slowly or orderly manner through the 6 cardinal fields of gaze. Stop movement of the pin light periodically so that the nystagmus can be detected. Cover your right eye, ma'am. Right eye, ma'am. Right. Assist for location for the light reflects by shining pin light on the pupil and corneal surface. Have the client fixed on a near or far object. Cover one eye and observe for movement in the uncovered eye. Uncovered test. Distance vision by asking the client to wear corrective lenses unless they are used for reading only. Ask the client to sit or stand of 6 meters from Snellen chart. Cover the eye not being listed and tested and identify the letter or characteristic. Take the 3 reading right eye, left eye, and both eyes. So moms, please stand up and cover your right eye. What letter is this, mom? And this? This one, mom. Okay? Perform the functional vision test of the client unable to see the top line and still in the chart. Okay, ma'am, place it down and document the findings in the client's record. Using the ears and hearing. Preparation. Assemble the equipment. Otoscope with the several size or ear specula. Procedure. Inquire the client if has any history the following. Ma'am, do you have a family history of hearing problems or loss? Presence of any ears problems or pain. Medication history, especially if there are complaints of raging in ears. Any hearing difficulty or onset. Use of the corrective hearing device when from it was obtained. Position the client comfortable and skated if possible. Uricles. Inspect the uricles for color, symmetry, or size and position. To inspect position of note the level in which the superior aspects of the auricle attaches to the head with the rotation of the eye. Palpate the auricle for texture, elasticity, and areas of tenderness. Gently pull the auricle upward, downward, and backward. Fold the penna forward, it should be recoiled. Fold the pinna forward and it should recoil. Push in with the triggers and apply the pressure to the measure process. External air canal and tympanic membrane. Using the otoscope inspection